Hello everyone, in this video we are going to talk about the motor points. The muscles that are supplied by median nerve are pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, flexor digitorum profundus, abductor pollicis brevis, flexor pollicis brevis, flexor pollicis longus, opponens pollicis. First and second lumbricals. To stimulate the median nerve, anode should be placed just above the cubital fossa. Cathode should be placed over the muscle that you want to stimulate. To stimulate pronator teres, cathode should be placed over the anterior aspect of the forearm just below the cubital fossa on medial side. The action of pronator teres is pronation of forearm. To stimulate flexor carpi radialis, cathode should be placed over the upper one-third of the forearm. Action of flexor carpi radialis is flexion and abduction of hand at wrist joint. To stimulate palmaris longus, cathode should be placed just medial to the flexor carpi radialis. Action of palmaris longus is flexion of wrist joint. To stimulate flexor digitorum superficialis, cathode should be placed at the wrist joint in the medial side. Action of flexor digitorum superficialis is that it flexes the middle phalanx. To stimulate flexor digitorum profundus, cathode should be placed at the wrist joint in the lateral side. Action of flexor digitorum profundus is that it flexes the distal phalanx. To stimulate abductor pollicis brevis, cathode should be placed just above the wrist joint at thenar eminence. Action of abductor pollicis brevis is abduction of the thumb. To stimulate opponens pollicis, cathode should be placed just above the abductor pollicis brevis. The action of opponens pollicis is that it opposes thumb towards the fingers. To stimulate flexor pollicis brevis, cathode should be placed just above the opponens pollicis. Action of flexor pollicis brevis is flexion of thumb. To stimulate flexor pollicis longus, cathode should be placed over the lower one-third of the forearm in the lateral side. Action of flexor pollicis longus is that it flexes the distal phalanx of the thumb. To stimulate first and second lumbricals, cathode should be placed just below the fingers. Action of first and second lumbricals is that it flexes metacarpophalangeal joint. To stimulate ulnar nerve, anode should be placed just above the elbow in the medial side. Muscles that are supplied by ulnar nerve are flexor carpi ulnaris, adductor pollicis, abductor digitium minimi, flexor digitium minimi, opponens digitium minimi, third and fourth lumbricals, palmar interossei, dorsal interossei. Cathode should be placed over the muscle that you want to stimulate. To stimulate flexor carpi ulnaris, cathode should be placed just below the pronator teres. Action of flexor carpi ulnaris is flexion and adduction of hand at wrist joint. To stimulate adductor pollicis, place the hand in mid-prone position, abduct the thumb and place the cathode at the end of the web space. The action of adductor pollicis is adduction of the thumb. To stimulate abductor digitium minimi, cathode should be placed just above the wrist at the hypothenar eminence. To stimulate flexion and opponens digitium minimi, cathode should be placed just above the abductor digitium minimi. Action of flexor digitium minimi is flexion of little finger. Action of opponens digitium minimi is to pull fifth metacarpal forward. To stimulate third and fourth lumbricals, cathode should be placed just below the fingers. To stimulate palmar interossei, cathode should be placed at the center of the anterior palm, keeping the fingers in abducted position. Action of palmar interossei is to adduct the finger towards the center of the middle finger. To stimulate dorsal interossei, cathode should be placed at the center of the palm in the dorsal side, keeping the fingers in adducted position. Action of dorsal interossei is to abduct the finger from the center of the middle finger.